Telehealth is increasingly seen as an important tool for enhancing healthcare delivery, particularly in rural and remote areas where healthcare resources and expertise are often scarce or even non-existing. There are many forms of telehealth, such as telemedicine, which is employed by medical professionals to view and discuss diagnostic information, and teleeducation. We'll now take a look at some of the benefits of telehealth. Telehealth saves time, costs, and the stress associated with the travel. It provides a new means for facilitating information and communication. Now, the patients and the healthcare providers don't have to travel long distances. For the patients, time spent away from their support system is not lost.
Well, one day it could be windy, next day it could be snowing, next day it could be both.
In the past, there have been a number of reasons that care is delivered to the patient and at the geographic location of the provider, including the inability to efficiently and effectively assess the patient's physical and psychological status. Telehealth provides new means for facilitating information gathering and communication processes that no longer require the patient and provider to be in the same location. A study in northern Canada found the ability to connect with patients through telehealth resulted in a 50% reduction in government costs and a 25% reduction on patient costs for medical transportation. In 1 year alone, 93% of the capital and operating costs of the telehealth system was recovered. Remote diagnostic devices such as ENT scopes and digital stethoscopes allow the physician to acquire important diagnostic information. When these technologies are linked with an electronic health record that allows the provider to access and review the local information about a patient, the clinical requirements for face-to-face encounter are significantly reduced. The episodic care model is where the frequency and intensity of care is appropriate to the individual patient needs. Telehealth provides more regular contacts, thus yielding more benefits. Patients are able to meet with providers on a more regular basis. Remote monitoring technologies makes data available to the providers on a continuous basis. Telehealth is a powerful tool to improve healthcare services for populations living in remote areas. It has the potential to facilitate access to and availability of services that would otherwise be difficult to obtain. Without telehealth, many of these patients would fall through the cracks. This collaborative approach allows the team to provide care for patients. Integrated care between health professionals using telehealth results in fewer delays in patient care decision-making. The storage of data uses broadband networks. The store and forward system allows for cases to be stored and seen at a convenient time by the providers. This technology is a practical way to conduct medical consultations, especially to the small, isolated communities with low volume of healthcare service usage.